session will be also much interesting to you all. Before just handing over to Dr. Indrani Chakravarti, so may I request my colleague Dr. Nirmala to formally introduce Dr. Indrani Chakravarti. Yes, ma'am.
Thank you, sir. Warm greetings to Dr. Indrani Chakravarti, Director of Calcutta Metropolitan Institute of Gerontology and Regional Resource and Training Center on Aging, and Dr. K.R. Gangadharan, Chairman of Heritage Foundation, Hyderabad, Dr. P. Ilango, Syndicate Member of our University, Chair, School of Social Sciences, and founder of BDU Heritage Center for Gerontology. My head of the department, Professor Mangleshwaran. My colleagues, Dr. Jerida and Dr. Rajavel, and participants. I deem it a great pleasure to introduce Dr. Indrani Chakravarti, who's the director. Today's resource person is also a very significant person we have, because Dr. Indrani Chakravarti is the founder of Calcutta Metropolitan Institute of Gerontology, Regional Resource and Training Center on Aging. And she is a founder of it, and CMIG is now recognized as the regional agency of the National Institute of Social Defense, Government of India, and Regional Resource and Training Center under the Ministry of Social Justice and Empowerment, Government of India. She is the recipient of a National Award in the year 2006 for generating and spreading knowledge in the field of aging. And she has received many fellowships. Few of it are, she is the research fellow of Indian Statistical Institute, visiting research fellow at Tokyo Metropolitan Institute of Gerontology, Japan, postdoctoral fellow at Netaji Institute of Asian Studies, Ashoka Fellow, ICSSR research grant on the theme Dynamics of Elder Care in Urban and Rural Milieu. She has been invited as a co-lead on the ICSSR ESRC research project, Aging Well in Urban Environments, Developing Age-Friendly Cities and Communities at Heriot-Watt University, Edinburgh, UK, from 19th to 26th January 2020. She had rendered her expertise in framing the policies, laws, and also an action plan for elderly at the Government of India and state level. Also, she has done a lot of work. She is an editor of Aging and Society, the Indian Journal of Gerontology. She is the author of various national and international publications with regard to the challenges of aging. And a very important contribution of her is she is one of the contributor in the UNFPA initiatives for building the knowledge base on the status of elderly in India. She is also guiding PhD scholars. Such a rich, experienced, dynamic, dedicated, and distinguished resource person we have today, who has worked a lot in the field of gerontology, who have worked a lot for the elderly. So really the session is going to be an enlightening session for all of us. So with these few words, I hand over the session to my head of the department. Thank you.
So, Madam, for a nice introduction.
Thank you, sir.
Yeah, thank you. Now it's over to Dr. Indrani Chakravarti for an elaborate presentation on the role of NGOs and the civil societies in the geriatric care. It's over to you, ma'am.
Okay. Good evening to everybody, and thank you for such an elaborate introduction. And my respectful namaskar to everybody, all the listeners in this seminar. Now, to start with, it is definitely a testing time for the entire human race And as a social gerontologist, I am very much concerned with the senior citizens, and whose number is increasing at an alarming rate. We all know that population aging occurs everywhere, including India. We have 114 million at present, and West Bengal, the state where I live, there are 77 lakh seniors, and the city Calcutta accommodates that is 5.5 lakhs senior citizens. This group, as suggested by the physicians, these senior citizens, they are very much prone to the threat of coronavirus all over the world. So our concern with this particular group of the society, of the nation. As a matter of fact, if we look at the socio-economic condition of India, we can feel that we are passing through a transitional phase which is not completely modern, not completely traditional. It is not the agricultural society. Even from agricultural society, we reached to the industrial nation, and from industrialization, now we are in the information age. So it's a long journey. And in this long journey, we have lost many things that we can talk about. The first is that our joint family system. As a sociologist, I must say that joint family system that is considered to be the best social security for older persons, and which is based on the dictum that from each according to his ability and to each according to his need, has completely withered away, especially from the city areas. And actually the large number of senior citizens now live either or with spouse in the cities. And the modern system of care, the formal system of care, is yet to develop in its full form in our country. So that is the first thing. In this backdrop, we will discuss what exactly we are going to do and what is the main theme of your webinar today. Now, then amongst the senior citizens, there are 114 million senior citizens, and who are the most vulnerable? We have to find out those senior citizens who are the most vulnerable. So policy and program should be directed first towards them. I think that amongst the senior citizens, those who are economically weak, 1/3 belong to below poverty level. Physically sick, as World Health Organizations report that 70% of our seniors suffer from multiple diseases. We are now very much familiar with the word because of this media publicity, that is comorbidity. So they suffer from comorbidity. Those who live alone in the city areas, many senior citizens live alone. Those who are childless, spouseless, and another group has cropped up. They are the parents of NRI. Their number is increasing at an alarming rate, the parents of NRI. And I think that these groups are the worst sufferers, especially in the backdrop of this COVID-19 breakdown. Now, as an activist in the field of social gerontology, I think that I realized that during this pandemic and during this lockdown state, we should know that what are the actual conditions of the senior citizens, what challenges they are facing, what are the domains where they are facing the challenges, and how they are coping with the challenges. Because sometimes, some few days I remember that there was no newspapers. We could not know anything about them. All our organizations that were shut down, and we didn't have any contact with our neither beneficiaries nor members. And under this situation, I felt that if I could contact them over telephone to know, to undertake a research, not research, is study, a documentative study, an action research, to know the three things from the senior citizens whom I know for quite a long time. So there are many, many senior citizens organization, senior citizens association, retired welfare organizations, Barishta Nagorik Mancho. So if I can contact some of them just to know that how they are doing, what are their problems, what are the domains, where they are facing the challenges, and what are these challenges, and how they are coping with the situation. So we have undertaken a study during this lockdown period, and we collected data, the first-hand information over telephone from 49 senior citizens. We tried to understand these three things: the domains they are facing problem, what are the problems they are facing, and how they are resolving or they are suffering from these problems. Actually, based on our general observation, we collected that information through telephonic conversation. And actually, our only objective is to know first the plight of the senior citizens. In this connection, I must say that all these 49 senior citizens, those we contacted during the lockdown period, all of them belong to higher SS, higher socioeconomic class, higher HIG group. They are economically privileged class. They are educated. They all are retired from organized sector. So since they have money, in normal condition, they can hire many things from the community. But what exactly they are doing during this lockdown period? That's my curiosity as a researcher. I would like to know that what exactly they are doing. Now, in this connection, my social workers, they collected information. I will discuss this later, but because before that, I'd like to point out one thing, that we should keep in mind that seniors, they do not form a homogeneous group. They're as heterogeneous as others. The plight of the HIG persons, these are completely different from the marginalized elderly. So what I feel, it is through my experience I'm telling, that any policy, any projects, any programs to be successful must be group specific. And we have different programs, different projects for different SES. Our current research was confined to higher income group only, and 49 were the representative sample of our group. Now, as a matter of fact, our research confined to HIG, and for the downtrodden, for the marginalized, we have different policies. I will discuss later because I have sent some PPTs to Professor, and I'm sure that at the end of my speech, he will show the PPTs, which I can get time to share these things with these learned gatherings. And now, through this research, this in-depth research, we have identified the 7 categories, 7 domains where our parental generation faces difficulties, the 7 domains. The first is that access to banking facilities, bank, money. Second is that access to food and all essential materials. Third is that access to medical services, because they suffer from various other diseases apart from this COVID-19 thing. The 4 is that role of community, role of police, role of club members, etc. And 5 is, I think, the most important, that is the ability to effectively use the digital services, their digital literacy level. I told you that they are educated, they have money, and they have some status in the society. But how far the digital literacy helped them during the time of this lockdown, that I wanted to know. And then access to domestic help, access to professionals and access to caregivers, etc. And finally, the psychological well-being, that is very, very important during this, because many are suffering from depression, anxiety, helplessness, insecurity. So it took a lot of time, hour after hour. They are just explaining that how helpless they are. So I will discuss some of the things with you, some of the case studies with you. But the first point is that these senior citizens, they're struggling to access the bank facilities because of the long queue, and the senior citizens counters were shut down during this lockdown period. Also, the ATMs were closed. All these things increases hassles, and their satisfaction level is very, very poor during the access to money. Second is the cancellation of important medical appointments. That it takes months together to get an appointment from a famous doctor. Doctor, as we all know, it is our experience, 2-3 months we have to wait, and all these appointments were cancelled. Then the upcoming operation, upcoming discharge of discharge from hospital, and especially the TIPs, the terminally ill patients, they are suffering from anxiety, the anxiety of relapse. Anxiety of relapse, that is very, very important point, I think, and they remain mostly connected with the family physician. Anyway, the next point, the next problem is that senior citizens, most of them suffer from health problem, and they cannot perform the ADL and IADL. That is the activities of daily living and instrumental activities of daily living. For their ADL and IADL, they have to depend on the domestic help and professional caregivers, trained geriatric animators, trained physiotherapists, and all these professionals, they could not turn up during, they cannot turn up. And in this crisis situation, it is not only my observation, it is the observation of all our senior friends, senior respondents, that the community, actually, community takes a very important role. The group members, the club members, irrespective of political party, the party members, the students, the housewives, the natural helpers, the self-help groups, the NGOs, all of them come forward and help the senior citizens to get essential commodities, to get medicines. Though medicines are sometimes being delivered by the medical shop, there is a support system in the medical thing, but the general complaint is delay. It takes week after week. So the patient, they cannot just wait for getting insulin or getting some important medicine. So that's enhanced their anxiety level. And sometimes they told me that they got cooked food from the NGOs and from the community, from the locality. The local people, they they reach out to them and they give cooked food to the senior citizens. So it is my observation as a sociologist, as a social gerontologist, that we are talking about formal care. We are talking about trained animators and trained, because we are also producing the trained animators, more than 2,000 who are working in the community. But when the formal care ceases, when it is not in operation, the community care is taking a lead role. So it is the community that should be empowered, that should be strengthened. So during the crisis period, Nobody else, no, for when the formal care totally ceases, so only the community come forward. And I must mention here the role of police, community police. Actually, their role in this crisis situation is really, really commendable. They have, their helpline is always on, and whenever the senior citizens need them, they help them in various ways. Now, another point is that this pandemic, actually, this pandemic has made the lives heavily dependent on technology. All of us must agree that without technology, we cannot perform our daily activities and some important essential things. And we have observed that the senior citizens are struggling to pay bills online. They cannot recharge their mobile phones. They cannot order food by using apps or through video conferences with children, those who are staying abroad. So under this situation, they feel very, very helpless, and senior citizens are helping each other only through WhatsApp group. I found that WhatsApp groups are very, very common, and everybody knows about this WhatsApp message, etc. And they stay connected, they share information, they share their experience, they stay updated through these WhatsApp messages. Now, the most important thing is psychological well-being, which is the physical problem also. It has its impact on the psychological well-being. And in this connection, I must mention the sufferings of the parents of NRI, the non-resident Indian. I talked some of our members who are actually the parents of NRI, and I found that the anxiety level is very, very high. Their anxiety level is higher compared to their counterpart in general. They suffer from that enhanced anxiety level because the children are outside. They are overwhelmed to the feeling that they may not meet their children anymore, even if some exigency arises, exigency happens in the family. So this type of feeling, this type of thought made them very sad, depressed, helpless, and also insecure. Now, actually, it happens that I can mention here 2-3 senior citizens. Out of these 49, I think the number is 5, who one of them expired during this, that unfortunate incident happened that expired, but his only son living abroad, and the son could not come, as you know, due to this travel ban. They cannot come, they cannot attend the last rite. And also, exactly in such way, some of the parents, they were planning to travel their children abroad in UK, America, or Australia, or anywhere. Or in some other part of the country, there also this all this cancellation of tickets, cancellation of travel, cancellation of everything, which has made them very, very anxious, sad, and they're full of grief. I got one case when the sister, the senior citizen sister, cannot attend the last rite of her elder brother. And elder brother lived in the same city, within the vicinity, but because of the house blocks, she was not allowed to enter into the brother's house. So she could not attend. She watched it through Zoom, through conference. So it is really, really unfortunate. The most important thing is that we should think about it, because in our lifetime, this is the first time we experienced all this unfortunate thing. There was no preparation at all. So I tried to collect information that of these unfortunate things, even those who are very, very higher SES, belong to the very, very higher SES, they have all the resources. all the resources, but they could not overcome this situation. This is the natural calamity. And having identified the need, our organization, CMIG, because we believe in action research, as Dr. Gangadharan said, that it is not the theoretical thing, as he knows me for quite a long time, that we always believe in the action research. Here, research and implementation of research in our organization, it go together. And we have identified these problems and created an umbrella platform, and we named it as Age Safe. Age Safe. What is Age Safe? Age Safe is a collection of video demos, some demos with elderly friendly videos showing step by step in a very elderly friendly way how to pay bills, how to prepare very easy recipes, food, without using the open flame. So we can at least cook something when the seniors cannot do the full cooking. They are unable to do it because of the physical problem. And also the measurement of vital statistics, because many of the senior citizens suffer from blood sugar, the glucose level, and they have to monitor this glucose level almost regularly or frequently. So how to monitor it? So our demo shows it, how to measure all the vital statistics and the blood glucose level. And also we apply the concept of elders for elders in such a way that the senior citizens, they contribute by showing how to do yoga or physical exercise, or through simple dance steps, very simple dance steps, which help the seniors to reduce tension. In this connection, I don't know how much time is there. I think time is there, yes. I will just, one point that our ministry has actually appointed a yoga therapist in almost all the old age homes. And these yoga therapists, they actually, a few days back, they asked that whether all the NGOs, those who run old age homes, whether they appoint yoga therapists or not. So this is our responsibility to find out that. But the question is that this, under the supervision of yoga therapists, the senior citizens spend some time doing the light exercise, some breathing exercise, some small stepping, dancing steps. It is only because it also improves the physical and mental well-being of the senior citizens. So that is very important, I think, during this period. And here in our video demos, the senior citizens, they teach these things, these small things, to the other elders. So this is the concept of elders. What exactly we are doing, it is LLL, LLL, that is lifelong learning. We also run this lifelong learning program. So I'm coming to this later. We have not much time left. Now we have actually uploaded this all these video demos in our CMIG portal. We have also released these video demos during this breakdown of condition, but it will follow up with the periodic practical workshop when this lockdown is completely lifted. The practical workshop will do, because generally we organize this type of digital literacy for the seniors many times in the past. Now, coming to actually the concept of care, if we say theoretically, concept of care is very, very traditional in our country. In Bengali, we call it Shipa in service. And the concept of care, it has different implications for different socioeconomic class. For the higher income group or the middle income group, the care means getting service, getting respect from the family, from the community. Whereas for the downtrodden elderly, care means income maintenance, income security, for survival. So it differs from different ACS group. And yesterday I have sent some PPTs to Professor Dr. Ilango. Sir, can I Can you please show the PPTs that about our organization, how we are providing care to the to different SES that I would like to show? Is it possible? Sure.
It's coming.
Yes, yes. Thank you, thank you. This is the Calcutta Metropolitan Institute of Gerontology. Yeah, this is the regional center. Next slide, please. This organization, we have been working for the elderly over 3 decades with the focus community development. What is community development? Community development is a holistic approach. It is based on Mahatma Gandhi's theory of Sarvodaya. That is, Sarvodaya means the upliftment of all. The father of the nation coined this term Sarvodaya in the year 1903 while translating John Ruskin's Unto the Last, Antodaya. Next slide, please. Next slide, please. This community development, no, sorry, the previous slide. I would like to, I'd like to tell something. Yes, sir, please. Now, this community development has 5 ingredients. I'm writing there 5 ingredients which will strengthen further, and that is our motto. That is community economic development, capacity building, community-based research, community empowerment, and community participation. All our programs, all our projects that we run, that are placed, all these programs, projects, and government things are placed under these 5 ingredients. Next slide, please. Next, please. Now, we have 3 major wings in our organization. One is research, another is training, and the third is service. So various, you know that you run the Gerontological Institute, and gerontology is a multidimensional subject, and various research we have undertaken, and we have a team of researchers from technology, from sociology, from psychology, and we run various research projects also. Next. Next, please. These are some of the research projects. These are going on. There are some research projects, ICSSR, ASRC, this project is going on, and also another project is going on. We are trying to get many more research projects because we believe that without research, no welfare program can be successfully implemented. So, next slide, please. Next, please. Now, as you know that we are the regional resource center of the ministry, and we done various training courses. Next, please. Next. Yes. Now, West Bengal, sorry. West Bengal, actually, it has 3 neighboring states. That is Bihar, Odisha, and Jharkhand. Yes. These are 3 neighboring states of West Bengal, Bihar, Odisha, and Jharkhand. The 2 states like Bihar and Jharkhand, these are allotted to us. In addition to West Bengal, we have to, these 2 states are under our purview. Next, please. Next, please. Next, please. Yes, these are the 5 activities of RRTC. We have to do all these activities as RRTC. Next, please. So please show some pictures. Please showing the pictures. There are various training courses. We organized these training courses from 2000 as the regional partner of NISD, National Institute of Social Defense. You know that gerontology is a multidimensional subject, and the students, the 6 months course and 3 months course, they need to read 9 theoretical papers since it is a multidimensional. In addition to 9 theoretical papers, they have to learn the practical aspects of it and also the interventional, therapeutic intervention. So all these things, the 6 months course, we generally introduced. Next, please. Next slide. Yes, this is the dietary counseling. This is the interactive session. The students are placed in the old age homes because this youth, they will act as the carer, as the caregiver of the senior citizens. So they must know that how to establish rapport with the seniors, how to talk with them, and it is always better to spend some time with the senior citizens. That's why we have network in the city. Many old age homes are there, and we send our students to these old age homes for practical things. Next, please. Now, CMIG trained more than 2,000 geriatric animators, and they are working in the field, they are working in the community, and there are more than 10, 12 aged care institutions are there that has come up, and these aged care institutions are taking these geriatric animators for their purpose. Next, please. Now, CMIG hosts 2 postgraduate courses. Our organization hosted. One is PG diploma course in gerontology and age management that is recognized by the University of Calcutta, and helping candidates work at various levels. They are getting, everybody gets something, some types of job. And it is MSc in Dementia Studies. This is a program on the distance learning mode in collaboration with the Stirling University School of Applied Social Science UK. Next, please. You see some photographs. This is actually the MSc Dementia course of Stirling University. Next, please. This is the networking. Actually, when we are working for the seniors, when I started working in this field, the awareness was very, very poor. Nobody knows what gerontology is, and in this part of the country, and why we are working for them. So still today, that networking and keeping in touch with various stakeholders, different stakeholders of the society is one of our activities. So you can see that physicians of SSKM Hospital, this is the conglomeration of Senior Citizens Association, the school children, and Panchayati Raj institutions. So we are disseminating information. That is one of our tasks, so that the community can come forward. And this is the services for the downtrodden. 1/3 of our senior citizens belong to below poverty level, and we should not and we cannot forget the plight of these senior citizens. Please show the next slide. Next slide, please. So you can see the origin. This is during the lockdown period. Our lady social workers, they distributed the food grains at their doorsteps. So if they are, everybody, they are our beneficiaries. We have 460 beneficiaries scattered all over the city, Calcutta, and this is the nearest slum of our office. They come to our office every day. It is within 3 kilometers, and they spend the whole day in our organization. So these beneficiaries, they are poorest of the poor. They have nobody to look after and no social security. And from our organization, they get everything that is necessary for survival. You can see the background of the beneficiaries, where exactly they are staying, and you can speculate the condition of their livelihood. Next, please. Now, this is our daycare center. We run 2 daycare centers in the city, in 2 diversified geographical area in the city, Calcutta. In this daycare center, the 50 beneficiaries come every day, and they get everything that is necessary for survival: food, medicine, treatment, all therapeutic intervention. Even our trained animators, they resolve their tension, they resolve their family dispute with organized trip outside. And the most important thing is that we give much stress on active and productive involvement of older person, and not just their care. So intergeneration, doing something, get some money. They just produce paper bags, but they get some money out of it. And this money enhance their status in the family. In addition to that, they get ration, they get tiffin, they get medicine, they get everything that is necessary. So it is Mahatma Gandhi's, I'm trying to total upliftment of the community. But there are many senior citizens. So far we could reach only a fraction of it. Next. They are the geriatricians and the physiotherapists, and they are associated with our organization, and they come once a week and they see our beneficiaries. So they get all types of help. This is another medical unit because we run 2 daycare centers. And this is a local youth. So actually, this is through our awareness program, they are aware now, and in some occasion they come. It may be the 1st October or the 15th June. 15th June is coming. This is the World Elders Abuse Awareness Day. And we have started working on how, whether they are tortured, whether they are abused in the family during this lockdown period. And we will discuss these points in some different platforms about the abuse of senior citizens, what they actually experienced during this long period. Because I came to know that they were very much scared that they will not get the food grains anymore because of this condition, the national disaster. They could not, even that storm that happened here. So all these things, it shattered our state, West Bengal, and they are really in a very, very tough crisis situation. So we are distributing food, we are distributing clothes, we are distributing medicines, everything. And this is World Elders Day. The college students, they are celebrating this and giving entertainment for all. So at the end of the day, you can see how happy they are. They are chatting. So there is no abuse, no problem, no grief. They are very, very happy at the sunset years of their life. So what exactly we want, that after this lockdown, we try to form some elderly self-help group. Actually, they are involved in income generation program. So we are planning to actually form some elderly self-help group, and at the same time include them in the National Education Mission. Because there are 2 things. One is education, another is income. These 2 pillars of empowerment, and we are trying to provide these 2 pillars to our members of the parental generation. And thank you very much for your kind listening. Thank you, sir. That's it.
Thank you very much, Dr. Indrani Chakravarti, madam, for your valuable inputs with your rich experience. And I'm very happy that you have the multifaceted personality. So not only because it's normally people can stick on to only one particular area, that may be an academic or the practitioner, but you seem to be of a different area. So I'm happy to note that being a practitioner, you are also the editorial board as in certain journals, right? And that is a very good sign. So now it is over to Dr. Gangadharan and Dr. Ilango sir for further elaboration or the consultation, and further we will go for a question and answer. Yeah.
Thank you, Dr. Mangaleshwaran. Thank you very much, Dr. Indrani Chakrabarti ma'am. That was a very inspiring presentation. You seem to be doing tremendous work. I heard a lot about you from Dr. Gangadharan, but it was a great pleasure to see the wide range of activities of your organization, and my very sincere happy greetings and appreciation to you for having run the Institute of Gerontology for such a long time. You were mentioning that when you started, there was absolutely no awareness. I can imagine what it would have been at that time, because I remember during the year 1999, when I started with some small initiatives in my town, Trichy. Even at that time, even though it was called the International Year of Older Persons, there was absolutely no awareness. So even in a city like Tiruchirappalli, we had to really convince people that we need to pay attention to the elderly. So I can imagine the ordeals that you might have gone through in bringing this institution to this particular stage, where you are, as Dr. Dr. Mangaleshwaran rightly
You know,
pointed
Vishnu?
out, academic and action project. That is a very rare combination. As Dr. Mangaleshwaran said already, we find a lot of academicians like us doing a lot of research, writing about it, and we find on the other hand people running old age homes or service providers who are doing tremendous work in different parts of the world. But they may not write much about it, they may not talk much about it, but you seem to be having both the sides. So my congratulations to you, ma'am. You started off with a very important point that our country's peculiar situation where we are neither agrarian society nor
Or information
you know
age.
yes, that's right, yes. So we are actually having a mix up of everything, so
Yes.
we are neither here nor there. So it's a very complex kind of situation, unlike the developed nations like US or Canada or Australia, where the technology divide and also the differences among the population is not so it's not so huge. But here
That's
the disparities are very glaring and very much among the people in terms of their digital literacy, in terms of their access to various facilities, in terms of their socioeconomic class, their cultural background, and all such aspects. I think you really brought out all the important aspects concerning elderly, the care of the elderly. And ma'am, as you were mentioning during your presentation, you mentioned that we are running an center for gerontology. But as you know, with Dr. Gangadharan's help, we have just launched it yesterday. It's a newborn baby. So the Institute of Gerontology is just an infant. Yeah.
congratulations very much. Yeah.
Yeah, it's just an infant, and we look forward to your suggestions and your support and your advice for
Surely.
running the center. And probably when the question answer session goes on, if there is time, could you kindly give us some practical tips as to how we might proceed in our university as a fledgling? It's a fledgling, Institute of Gerontology, Center for Gerontology. So we would like to hear from you
I'm very
a few tips to, take this forward. Thank you so much, ma'am. Thank you so much.
surely, sir. Surely. Yeah. Thank you. Thank you.
Okay, now, yeah, I will. Oh, Dr. Indra, fabulous, absolutely fabulous. I think there is nothing more to describe than to say it's fabulous presentation. I'm sure all of them would like to, because we have been seeing chat box filling with a lot of appreciation. It is true. What I like about why I talk about you everywhere is you are one person who is not working with affluent class like ours. You work with people who really deserve it at the bottom of the pyramid. I think that is something that I always admire in you. Whenever I see you, I get inspired to do something more. I still don't work with the poor people, but you work with them. And I think that's a presentation which everybody would love to be fond of in this country, and particularly the academic field and those in the research. It's just a fabulous thing that you are doing. I wish that God gives you the continued energy to continue to do well. And now in terms of Gerontology Institute, when you're talking about 35, 40 years, all by yourself, you have been doing it. And now here is a university that has come forward to say that let's start doing something. And it's going to be a long drawn battle for us to really fight the bureaucracy and also move in the direction. With all that, Dr. Indra, my concern in this country that not many people have moved into aging field like any other field. And very few people have very recently come in on talking about it. I'm not part of that group because they're all so commercial in their approach. They look at everything as money from the senior citizens. So that's a big concern for us, particularly when you're talking about NRIs. When we run our facilities in Hyderabad, we are very keen that we don't charge money anything more than what is needed. All the buildings are our own. There is no building we have taken on rent. We have built good properties. We own those properties. We ensure the property is used for a cost. It doesn't mean that we are giving it free, but we are definitely charging but we are very conscious about the fact that we will not make money out of these buildings. I think that is a philosophy on which we have been running 4 facilities. I'm very sure, we may not be able to come to your situation of what you are doing. Now, in respect to the program that you mentioned, like your police programs, PRI program and all that, it's fabulous because we are also doing that extensively, particularly in Tamil Nadu and Telangana, like you are in Calcutta for the last 15 years of RRTCs. We have been an RRTC for 5 years. I must tell at this point of time, Dr. Elango, Dr. Mangaleshwaran, Jerida, Nirmala, I think in the entire social work department of Bharathidasan University have been conducting programs probably not less than 4 years now. All our programs in Trichy area is always done with the Department of Social Work, except last year we took a little break for some reason. Otherwise, they have been doing all the programs, and I think that has been one of the reasons for us to also collaborate with them to set up this facility. They are very keen that we train people. And the NGOs in Tamil Nadu are very keen on setting up a training program for them. They are requesting us to do a training program for them, which hopefully will commence very, very soon, in the next 2 weeks' time. I'm probably both involved with Madras School of Social Work, where I studied from, and the Bharathidasan University, both the universities put together and do some training program very, very quickly. These are all the things I thought I will probably, let you know, so that I think our practices, it's been wonderful the last 4 days. If you really look at 2 days, we had Rajan, a researcher and a person with an expert on migration and aging. We had Professor Shivaraj, who was talking about a lot of inputs that he has been personally involved in variety of research and also activities. And this morning we had wonderful psychology input from 2 people from Nimans and one from Chennai. I think learning for whoever has been listening to it, I think they have earned really a good capsule of what is aging, what is really happening in the aging. So we spoke limited only to COVID, but people covered, Dr. Shivaraju covered the entire gamut of what is aging and what really happens. I think that way, I think Dr. Elango and Dr. Mangaleshwaran and the team have put together a solid team that could, pass on a lot of knowledge to people who are listening. And thank you once again, Dr. Elango.
Yes, sir.
Thank you very much.
Thank you, sir. Thank you for your nice word of appreciation to the department and madam's presentation. And the morning, we were not able to provide an ample of opportunity for the Q&A, and I think madam is available with us, and already the chat box is filled with a lot of questions. I can just put a few of the questions so that you can just able to answer, Madam Indrani Chakravarti. So there is one question from the participant that yes, madam. How can we ensure healthy aging during the time of COVID-19 and post-COVID-19? Are you able? Are you able to hear you?
Yes. Our focus should be maintaining functional ability. As defined by WHO, that is the definition of healthy aging, maintaining functional ability. So our only focus is how to maintain functional ability during COVID or when all this lockdown will be lifted.
Doing those things which he or she cherishes.
Doing those things which he or she cherishes. Doing those things has reason to value, and the reason to value and cherishes by the person and to maintain functional ability. These are the 3 things that actually healthy aging defines. 3 things that healthy aging defines: maintaining functional ability, the whatever she or he wants, he cherishes, he do it, and just to give value to this. It has some meaning. So this is with this background we will work. That what exactly we are doing, community-based model. We will do the community-based model, and during this community-based model, our basic objective is to empower the community, empower the local youths, empower the housewives, empower the police, and we have the training need assessment to them. and with the police, with all the stakeholders of the society, just to empower community. And that is when the functionality, that is the healthy aging. That is the basis of healthy aging. And what you want, you get. Whatever you value, do it. So that is the thing I would like to say.
Yes, madam. Thank you. And how we can reduce the threat of death among the elderly during COVID?
Yeah?
Fear of death and the death.
Fear of death. Okay. The fear of death, this is true with the group. If I have elderly cell group, elderly groups in different, that is why they also act as pressure group. Increasing the social capital. The basic objective is to increase the social capital. The senior citizens group, whenever they stay connected, whenever they share things, their problems, their grief, their anxiety, everything, if they release, if they update themselves, it really, thanatophobia will be decreased. Thanatophobia will be decreased, but it is very, during this situation, this pandemic, it really increases because there is very little chance, very little opportunity to mix up with the people. So whenever we mix up with the people, whenever we form group, it may be elderly self-help group, it may be the senior citizens learning group, or as we run the Silver Circle group, there are more than 100 members who learn something, learning, lifelong learning. All these things actually.
We have started a project, Silver Awakening.
We have already started a project. If I get any opportunity, as that sir said, that some tips, we named it as Silver Awakening. Silver Awakening. Death is inevitable. Nobody can defy death. But how to accept this? This is Silver Awakening. Through various programs, through various things, we can do it. And that is through the groups, which will act as pressure group. Huh?
Making them elderly self-sufficient.
We are trying to making them self-sufficient so that they will not think about it. All the religious practices, ritual things, all things will include. This will include everything.
Yes, madam. Ma'am, have you seen or experiencing any new issues or present challenges other than economic, health, psychological, and spiritual issues? So their question is that apart from the economical, health, and psychological and spiritual issues, is there any other challenges in the present scenario?
Social is there. Mental health.
Yeah, that's what I have mentioned as psychological, economic, health, and spiritual. So is apart from these, 4 areas, is there any other challenges they want to get to know?
Very low social capital for the elderly during COVID.
Very low social capital for the elderly during the COVID. So what are the issues? The issue is communication channels are cut off. Very low social capital. So these are the challenges that we are facing. We are seeing this low social capital, and the other thing is that care. The concept of care. It is a combination of, when we are talking about care, either it is formal or it is informal. But in the research, our research shows that actual care, it combines, as Dr. Professor Negan, the Japanese sociologist, say that it is social care, it is combination of formal and informal care. When formal care and informal care combined, that is the best care. That is why community care and the professionals, this is the field that we are working, and that will through this develop the social capital.
Yes,
that's it.
And yes, ma'am. Thank you. So how we can work with elderly in a non-institutional setting?
That is why geriatric animators are there. These geriatric animators, these trained personnel, they will provide all this type of domiciliary care to the seniors. Even the nonagenarians, the 90 plus senior citizens, These 90 plus senior citizens, I know many of the senior citizens, they live alone with the help of these geriatric animators. They're trained by the government through our NGOs, through RRTCs, just to provide help, care, support, all the social, psychological, mental, spiritual support to the elderly. They are educated, they are trained, and they know how to establish rapport with the senior citizens. And through this, we are mobilizing the resources, we are mobilizing the social capital for the seniors. So we are trying to develop medical services and try to combine the formal care and informal care. So the multi-pronged approach should be there to deal with the senior citizens.
Yes,
Multiple stakeholders, involving multiple stakeholders.
yes, madam. Is there any possibility of having a mobile support team to address the needs of the elderly?
Sorry?
Is there any possibilities of having a mobile support team? Mobile support team to address the needs of elderly. Yeah. Have you got it, madam?
Yes, yes. These are the community gerontologist concept. We have already introduced this community gerontologist concept. These are the mobile support system. Suppose I am working with the West Bengal government on this community gerontologist concept. What is that? The community gerontologist concept is that we will provide training to the young old, those who are from 60 to 70, to the housewives, those who are suffering from emptiness syndrome. So we will provide them some kinds of training so that they can work as mobile team to the community. And they will this customized training will be provided by us. But this group, potentials, the heavy potentials they have, and they are very much eager to contribute something to the elderly persons without any preferably intergenerational solidarity, the youth of the society. We are talking about the youth, we are talking about the young old, we are talking about the housewives. They can actually, we will provide customized training to them, and they will help the seniors as community gerontologist. And the name is given by us, that is community gerontologist.
Oh, fine. That's another interesting question. Everyone needs to undergo aging gracefully the process. How do we get ourselves prepared even for from our late adulthood? I think for people like us, so we need to prepare for the aging. So how we can make to prepare ourselves ready for the aging process? I think senior people can also address this thing, like Professor Ilango, Gangadharan. So help us in preparedness, because like disaster preparedness. Of course, this is not a disaster. This is to prepare for an aging.
Yeah. So the preparation, the planning should come from the year at least 5 to 10 years before retirement. So it's a planning, it's a full planning, and through aptitude test, we can tell you that how you can plan your retirement. We have planning, sir. We have planning for everything. We have planning for money. We have planning for health. But how we will actually spend our time, how we will actually remove this fear of death, that is thanatophobia. So it is also, your question is also linked with the answer of healthy aging. So functional ability, the formation of social capital, and your mixing with the other age groups, intergenerational solidarity, all these things together help you to live longer. Next generation intervention is very, very important. So that is why from school children we start. Yeah, and you know that Kalash's model shows that in every phase of life, Kailash shows that the very renowned gerontologist, Kailash shows that in every stage of life, some intervention is required, and how this intervention was required by whom, it is a model. The model is there. If you want, I can send it to you. And that is the answer of your question.
Okay, thank you.
Thank you, Bill.
Yeah. Is mobile medical support team possible by gerontological center in the COVID-19?
It is possible because we have been running this mobile medical unit from 1993, support team. But at this moment, I'm not sure that doctors can answer better than me that whether this mobile medical unit with a whole support system, they can go to some place or they can do the work. During this COVID-19 period, whether it is applicable or not, that the professionals can say. But in normal situation, we have been running this mobile medical unit for the last 20 years. So it is very, successful program. When the seniors cannot come to the hospital, when the seniors cannot go to the doctor, or they cannot, they don't have money, the marginalized section, for them the mobile medical unit is the only solution. That's the only solution.
Members go to their place.
And this is the domiciliary service. They go to their doorstep and provide medical service to them. So that is very important. Actually, our government, the MSJ runs this program out of this IPSRC, as Dr. Gangadharan knows that one of the programs is mobile medical unit. And I have been running this program from 1993. And it is very successful program, but I'm not sure that government is encouraging this or not because of this assembling, etc. So the mobile support team can be formed in the similar lines as mobile medical camp is doing. I think this is the answer.
Yes, ma'am. The West Bengal has always been having a different political dynamics. And how do you compare West Bengal with other states in terms of elderly care?
It is very difficult to do anything here, sir. Very difficult to do anything in West Bengal.
The power dynamics rested the political authority.
Power dynamics is completely rested on the political authority. Power dynamics is rested on the political authority, and without this, we cannot go anywhere, we cannot do anything, and every time at different level we have to go, and I have to fight. So when Dr. Gangadharan said that the last 3 decades I have been fighting, as you said also, so it is that's why the journalist named me a rare academic activist. Because here in West Bengal, to do something, one must be an activist. Without this, we cannot do any work because power dynamics is different. I think it is always better when we work at, even in Bihar, Jharkhand, it is slightly better, slightly easier, I should say.
Impediments are less.
Impediments are less.
Yes, ma'am. Being a social worker, how the social work intervention is being done in retired old women adjustment problem, but adding to that, being a senior person in the field of gerontology, what would be your advice for the young people or academicians or a practitioner to take up what kind of intervention, social work intervention you would suggest, so that, for example, they want to go for a research of pre and post study, and between some kind of intervention is needed. In that case, what kind of intervention do you suggest for the elderly people, for the betterment of elderly people?
2 things are there. Only 2 things are there. Action-oriented community participatory research, action-oriented participatory research, and community care model. Action-oriented participatory research and community care model. Without this community care model, it cannot be a holistic approach. to provide an holistic approach,
All domains of life.
community care model, which consists of all these practitioners, where they can work, where they can contribute something, can actually, that will help. And promoting the concept, as you know, that we are doing all these things, that is elders for elders. Elders for elders is a new concept, where elders, young old and middle old and very old, as you know, and where the young old are providing service to the very old. So these are all community development model, where the younger old can act as community gerontologist, when the middle old can act as community gerontologist. They can take, actually, when I did my postdoc work in Japan, and I actually in Japan, I saw that how the young old are providing services to the very old in the community. They also, they bring the food, the cooked food to the very old person and to the house of the very old person, and they feed them.
Yes, madam.
Researchers should concentrate more
Building a community which is
on
conducive to healthy aging.
building a community. Researchers should concentrate more on building a community which will promote healthy aging, graceful aging, active aging. So researchers should focus more. The more research should be done on healthy aging, active aging, with the focus on community development.
Yes, madam. How we can work with the below poverty labeled elderly people? BPL.
That I have been doing, sir. That I've been doing for more than 3 decades for the marginalized, to have nobody to look after and no social security. And in every stage, irrespective of the political power, I have to sit together with the local clubs, and with their help, we have to go there. In the you have seen the pictures that all our staff, they were there in the remote, the slum areas. So without their parties' consent, door-to-door service, door-to-door social workers visit cannot be done without parties' consent. So
problems are abuse.
So the most important problems are abuse there in the marginalized abuse, because you know that when during this lockdown period our social workers go, they thought that it was stopped. And when they see the food grains are coming, if you see their faces, that they convinced that yes, it is food for them. So they will not suffering from hunger or. So they're actually a burden. So from burden to asset, because they are I am actually making them from burden to asset, because when we picked them up, they were the burden, the surplus member of the household. Now they are taking so many food to their houses that they are becoming a very respectful, not very respectful, but reintegrating them to the main stream of the society. That is my achievement, I think. And that is the most important thing in a society like ours, where 1/3 live below poverty level. To integrate them with the mainstream, it is by elderly self-help group, setting up elderly self-help group, providing them some food, etc. That is my only objective throughout my life. Silver awakening is all about. We are going to do this silver awakening.
Yes, madam. Thank you. And regarding now, please have a water, madam. So you would be
So many questions are there, sir.
Sorry,
Professor Mangal sir, I would like to ask Madam one question or thing. Can you me permit? Okay.
Yeah, let madam have a water.
Oh, yeah, sure.
Go ahead.
Just a while.
Go ahead.
Good evening, madam. It was a wonderful session. We admired you for the work and for the presentation, the yeoman service that you're doing. So maybe you have covered all areas of dimension in taking care of the elderly. At this point, it made me to think two points, I should say. One is, have you documented the resources, the skills, the experiences they have? And my another question, maybe I do not know whether it is applicable, it can be done or not. The second one is adoption. Has anyone come for adopting the elderly people? And so this one I would like to get an answer from you.
Very, very good questions. Professor Nirmala, you are Dr. Nirmala, isn't it?
I'm Dr. Jerida.
Jerida. She is one of our colleagues, senior colleague.
We had that sponsorship program in the past. That is Adopt a Granny program. Adopt a Granny program. That is Helpage India's very, very popular program. And one-to-one program. One person looking after one senior citizens. So I am telling that we had that, but when Helpage India withdrawn the program from Calcutta, so we are mobilizing the thing. We motivate the people in the community to take care of one person. And at present, we have 59 adoption program still going on for these senior citizens. These senior citizens who cannot come to our daycare center, who are feeble, who cannot, who are almost bedridden, cannot come. So our neighbor, as sponsor, they go to the place and distribute the food. So it is there very much.
Thank you so much, ma'am.
Thank you. Thank you for this question. This is very important.
Yes, madam. And the present scenario during the COVID-19, and we find it difficult for one-to-one counseling, and therefore we need to go for a telecounseling or an online counseling. So how the counseling is done for an isolated elderly? Have you got my question, madam?
By video conferencing, audio call, video conferencing, video conferencing.
No, but isolated elderly or elderly with BPL, but do you think that is it possible for them for a video conferencing or through any kind of
No. Those who cannot write, those who cannot read, for them video conferencing is not applicable. It is not the solution. It's not the solution for the below poverty level elderly. In that case, we have to bring them to our organization 10 at a time. As in our state, it is stated that 10 persons can be assembled. So in our daycare center, I can call 10 persons at a time for group counseling or for one-to-one counseling, which I used to do in the normal situation, because they have many problems. They are the victim of abuse. They have many serious problems. So counseling is a very important part of our activities, and in our curriculum, counseling is always there. So for the below poverty level persons, those who cannot see the video thing, etc., video conferencing, or they don't have any smartphone, they cannot understand these things. For them, we have to ask them to come and fill in our center.
So thank you, madam. I think I think we are putting lot of questions to you. Of course, there are still more questions are there, but due to the want of time, right? And our respectable registrar has also joined us for his valedictory inputs, right? So I'm happy in welcoming our respectable registrar to our webinar on the COVID challenges and implications for senior citizen care. Welcome, sir, Dr. Professor Gopinath, sir. And he is a very dynamic person with the able guidance of our Honorable Vice Chancellor. We are able to, as I told you yesterday, we are able to obtain A+ with a CGPA of 3.32. And the recent one, the last week, our Center for World University Ranking, we are able to get 1,947 and 19th rank among the government universities in India, and the second rank among the government universities. So he's a very good administrator and a very techno-savvy person, and he has played a very different administrative role in BDO and other areas as a chair, as a head, as a member syndicate, as a member senate, finance committee, member IPAC, chairman of board of studies, and research also. So he has almost published more than 100 plus articles, and he has guided almost awarded with 14 PhDs, and he has visited almost 25 countries. And of course, lot more to talk about Professor Gopinath sir. So with this few words of welcome, I welcome Dr. Gopinath sir to this virtual platform of this conference, of this webinar. So it's over to you, sir, for your valedictory remarks.
Thank you, Dr. Mangaleshwaran, for your remarks and the inputs. And before I start, I would like to congratulate the Department of Social Work for this initiative and this endeavor. And I think this is the second time we are meeting in a very short. So I simply salute for your technical, initiative, and you're very active virtually, right? So thank you very much for giving this opportunity to be with you on this evening, and also thank Dr. Ilango for connecting me to this engagement. So I'm so glad, and also I congratulate the Department of Social Work for launching a gerontology center in association with Heritage Coimbatore. So I think it's another feather for crown in the Department of Social Work. So I'm really glad and happy about it. And of course, this topic is quite interesting, and I know the elderly people are conveniently ignored these days, and we are neglecting their status. And I have some issues with the phrase social distancing. People are using the word social distancing, and people like Mangaleshwaran, many leaders, many professors are fighting for social together, right? And social closeness, and now we are using the word social distancing. It should be physical distancing rather. So, so I don't use the word social distancing because I may be politically incorrect before people like you. You're a gerontologist right now, right? I'm just a layman in that sense. And of course, the vulnerable senior population in terms of COVID impact is more than 22% according to the Indian survey. So we have to protect them. So we have to prepare them from this pandemic, and we have to educate them. Of course, already they are suffering from a lot of one issue I can say is they are physically abused, financial abuse or social abuse. So they are having a lot of issues now, other than this COVID issues right now. But we have to educate them in all dimensions so that they are protected and they feel mentally and physically well. So for that, there are many discussions have been going on, and I found a lot of people are discussing in length and breadth. So how we can do even adoption programming. The lady was talking. She was so wonderful, and she was giving a lot of suggestions and strategies. I think we have to tell the government, both locally and nationally, people, and how we can basically. So we have to tell the government, and we have to provide the PPE and the personal protective equipment. So these kind of gadgets or equipment must be given to them, to those people, at least for the old age homes or long-term care homes. So that people can, feel comfortable physically in terms of health-wise. Of course, as I said, the senior people particularly who are staying at home, the old age home or a long-term care home, so they feel, in my opinion, so they feel lonely. So there are major factors whenever I encounter this kind of people. So they say that three things. One is fear for death. So that's the biggest issue they are facing. And the second one is loneliness. They feel completely aloof. There's no companion. There's no people to talk, to share. The third one is they feel lack of medical care. So these are the three important things, in my opinion, physically, because you know better than me. So these are the three major issues they are suffering from these days. So apart from that, we have now COVID also. So how to educate them, how to protect them, and how to prepare them from to face this kind of turbulent times. Of course, in my opinion, they are wise people than us, because I always call the elderly people as smart people. They look very beautiful, right? So you may be surprised when I say the old people are looking beautiful. They are more beautiful than young people in terms of knowledge, in terms of wisdom. Of course, the young people, they are very smart, they are knowledgeable because of technology, and they are getting a lot of inputs from different sources. But the older people are very, beautiful, in my opinion, because they have wisdom, they have maturity, right? So that lesson we have to carry out to the Gen X. So that they will be, taking care of the older people. They will not neglect them. They will not ignore them. So we have to celebrate the old people. So for that, of course, people like you are working on a lot of mechanisms. So the Department of Social Work, as a gerontologist, so you have to devise some mechanisms. I think one suggestion I got from your speech was adoption. So you can adopt, maybe an individual can adopt a old person, or even a corporate can adopt a old person, or a group of people, or even a group of homes, old age homes. This is one thing. But another thing is, of course, as a gerontologist, you must think about how to make people more active. The older people are little, so they want to be more active. They want to be more taken care of. So we have to make them active by giving some role-based activities. So infuse them some spirituality, even music or even movies and any type of entertainment, because they know a lot of things. So we have to extract them from their knowledge, from their experience, from their exposure, and they've evolved from over a period of time. So we have to get knowledge from them. We have to extract meaningful insight from them. So that's my humble plea to this forum right now. Of course, when I met one old lady in Chennai a few years ago, they said, I'm afraid of death. I don't know when the death is going to come to me. So that fear is there. I don't know how your people, you have any mechanism or strategy to help people come out of this kind of fear. Because we have to tell them that is not just the end, it's only a comma, right? So we are not enjoying our life because God has given to us. So death is also a part of the life, so we have to enjoy death also, right? So I think death is not a full stop, it's only a comma. So we have to educate them mentally, spiritually, so that mentally they are capable of facing death on any kind of, I always say that the last rituals. So we are focusing on that particular point, last rituals, because many people, when I encountered for many occasions, they said, I'm afraid of death. So because they are not having any people, the children or the grandchildren, they are not near with them. So they say that I'm totally aloof and I'm afraid of death. So probably you, as scientists in this field, you can think about some kind of mechanism to, alleviate this kind of fear that will make them more happy and more active and more robustly, meeting with other people. But anyway, so these are my few random thoughts. I would like to close my remarks with one particular thing. The old people, they brought us to this world. They taught us this world. Now we are building a new world without them. So we have to have a better place, better living place for those old people in this new world. So as Bharathidasan University, we are creating a new brave world. Definitely we have to create a new brave world wherein we bring our old people must be part of this new world system. Because we are going to be old. So otherwise when we become old, there's no place for us. So there's a fear for us also. So somehow we have to have a connectivity between the generation, our generation, the senior generation and the junior generation. So you are going to be a bridge between these two generations. I think with these points, I congratulate the Department of Social Work for this great endeavor, and particularly launching a new Center for Gerontology, and giving a lot of technical inputs and conducting a lot of webinars in such manner. So simply congratulate all the team and successful. I think it's a closing remark. So anyway, you have done a wonderful turbo charge sessions for the past 2 days. I was going through the agenda. It was wonderful, and I hope we have enjoyed for the past 2 days through this webinar. And also, I particularly congratulate Dr. Ilango for gearing up this initiative, and Dr. Mangleshwaran for this endeavor. So again, wish you all success, and thank you very much for this opportunity. Right, bye-bye.
Thank you, sir. Thank you for the very fabulous valedictory remarks, sir. So thank you, sir. Before just going to the formal vote of thanks, let me invite Professor Ilongo to give a closing remarks.
Sir, he has to unmute, sir. He has to unmute.
Sir, unmute, sir. Ilongo, sir, unmute.
Yeah.
Yeah, please.
I'm sorry about that. Yeah. Good evening, everyone. My respectful regards to our Honorable Registrar, Dr. Gopinath Ganapati. Sir, your remarks were very apt for the occasion, and it shows how concerned you are about the welfare of elderly. I remember even in one of the programs which we had earlier in collaboration with the Heritage Foundation, you shared a lot of valuable experiences and thoughts relating to the elderly, which I found to be very useful. And so I thank you for joining us and giving us the valedictory remarks. On the whole, the webinar had been a wonderful experience, and we have had stalwarts in the field of aging, starting from Professor Hriday Rajan, who is a great demographer associated with the Center for Development Studies in Trivandrum. And we had Professor Shivaraju, very senior aging, research, a researcher in the field of aging from Tata Institute of Social Sciences. And we had Dr. Tirumurthy from NIMHANS, Professor of Psychiatric Social Work. And we had Dr. Ravi Samuel, who is a very senior psychotherapist from Chennai. And this afternoon we had Dr. Indrani Chakrabarti, who just concluded her presentation, which was extremely inspiring and very, intellectually and also very pragmatic. It was stimulating our, minds and providing a lot of food for thought as to what all can be done for the welfare of the elderly. On the whole, these 2 days of webinar, I'm sure would have been very beneficial to budding social workers and also young social workers, maybe even mid-career social work teachers and other research scholars and everyone. On the whole, as Registrar pointed out, I think as gerontologists we have to function. I think we have to keep in mind that a gerontologist is not from one particular discipline, because as mentioned even in the earlier session, gerontology is a transdisciplinary area, not just a multidisciplinary area. It's a transdisciplinary field where almost every professional has a role to play. Our Professor Gopinath Ganapati is the senior professor of computer science and applications, and even he has you have a greater role to play, sir. I think every one of us, irrespective of our professional affiliation or our professional background or whatever may be our skills, this is an area where all of us can contribute. I think in that manner, I think unless we all join together and work for this neglected segment of population, we cannot really make much progress in the care of the elderly. So I think with that note, I would like to thank you all for your patient listening, and thank you so much, Dr. Mangaleshwaran. Thank you so much.
Sir. Thank you, sir. Thank you. Nice of you for having a concluding remarks. Now, may I invite my colleague, Dr. Rajavel, and the Deputy Coordinator for the Center for Gerontology to formally propose the vote of thanks.
Dear participants, a very good evening to all. It gives me an immense pleasure to deliver the vote of thanks for the event who took part in this 2 days webinar on COVID-19 challenges and implications for senior citizens. I would like to thank our Honorable Vice Chancellor, Professor P. Manishankar, Bharathidasan University, who honored this webinar through the official launch of the BDU Heritage Center for Gerontology. His inspirational speech and his thoughts of the old age care, he himself admitted the need and support of the old age care is need of the hour. I keep on record our indebtedness to Dr. K.R. Gangadharan, Chairman, Heritage Foundation, richly deserves our gratitude, and I offer the same. We remain grateful to Heritage Foundation, Hyderabad. We remain grateful to Registrar. Our words may not be capable to communicating our sense of gratitude to Professor Gopinath, Registrar of our Bharathidasan University. I may take this occasion to salute Professor P. Ilango, Department of Social Work, Bharathidasan University, and syndicate member, Bharathidasan University, his brainchild of BDU Heritage Center for Gerontology. We offer our sincere thanks to the speakers of these 2 days, Dr. Irdhirajan, Professor, Center for Development Studies, Trivandrum, Kerala. Permit me to mention our appreciation to Dr. Shivaraj, Professor and Deputy Director, Tata Institute of Social Science, Hyderabad. I bow my head and gratitude to Dr. Ravi Samuel, Psychotherapist, Psychotherapy Clinic, Chennai. We are happy to mention our obligation to Dr. Professor, Department of Psychiatric Social Work, NIMHANS, Bangalore. We express our gratefulness to Dr. Indrani Chakrabarti, founder, Calcutta Metropolitan Institute of Gerontology, Kolkata. I hereby acknowledge our Professor and Head, Dr. R. Mangleshwaran, for his tireless effort. I am happy to declare thankfulness to my colleagues, Dr. J.O. Jerida Namjen Elju, Dr. D. Nirmala, Assistant Professors of our department, and Dr. Suresh Kumar, Dr. Karthikeyan, Dr. Selvamani, guest faculties of our department, and also extend my thankfulness to Mr. John Milton, PhD scholar, and Mr. Leone, MPhil scholar, and Mr. Pugalendi, MSW student. We not only feel, but also express the same feeling of gratitude to all the participants globally. Finally, I solicit your continued support and encouragement to march forward in our quest for knowledge. Thank you once again. Thank you.
Thank you very much, Dr. Rajavel. So thank you, participants. So we hope to see that, and as you all know, this is there is, hello.
Yeah.
Yeah.
You are audible.
Yeah. Yes, sir. So as you all know that this is the 5th webinar being successfully conducted by our department, and most probably my own colleagues will join